Hello guys, welcome back. In this video I'm going to talk about the left ventricular global longitudinal strain. All the most important things you need to know about LV strain is here. I hope you can find this useful. Don't forget to like this video and to subscribe to my channel. So let's start. Let's start with the basics of global longitudinal strain. Assessing left ventricular systolic function is central to the evaluation of cardiac disease, playing an essential role in guiding management and predicting outcomes. Yet, the echo community has long understood the variability and accuracy limitations of the traditional measurement techniques for left ventricular ejection fraction, regional strain, and global longitudinal strain. Since the development of speckle tracking echocardiography more than 15 years ago, multiple studies have suggested that strain, which assesses deformation directly in the myocardium, could be a more useful marker of left ventricular systolic function. Global longitudinal strain can identify subclinical left ventricular dysfunction before declines in left ventricular ejection fraction become apparent, and it can predict mortality and morbidity in numerous cardiac conditions, including heart failure and, of course, this famous virus. Also, it can inform treatment decisions, furthering the cause of personalized medicine. The American Society of Echocardiography and the European Association of Cardiovascular Imaging both encourage more clinical use of strain because of its ability to detect disease sooner than left ventricular ejection fraction. But despite this advice and GLS' proven ability to offer additional prognostic value, practical considerations have proven to be a barrier to wide-scale adoption. And why GLS is technically challenging? Because using this conventional technique requires additional training, specialized equipment, and additional analysis time. However, with the advent of more advanced imaging and newer technologies such as artificial intelligence, all that is starting to change. One of the most important questions is, why GLS matters? Non-invasive evaluation of left ventricular systolic function by echocardiography remains one of the most pivotal measures in clinical cardiology. Currently, left ventricular function evaluation centers around two main techniques. In the modified Simpson's biplane method, the left ventricular ejection fraction is estimated by assessing the percentage of change in ventricular volumes between systole and diastole. And echo services with relevant experience and available software packages tend to use a more advanced 3D volumetric assessment, which allows for the acquisition of the entire left ventricle in a single volumetric data set. These conventional methods, however, are subject to a number of limitations. Left ventricular ejection fraction can be normal in the presence of impaired left ventricular systolic function, since it doesn't reflect intrinsic myocardial contractility. In addition, left ventricular ejection fraction is highly load-dependent and suffers from a high degree of intra-observer and inter-observer variability. Reliability very much depends on experience, image quality, and the ability to see the endocardial border. How can we assess the left ventricle with global longitudinal strain? Almost 2 decades ago, speckle tracking echocardiography introduced the new approach of strain, or myocardial deformation. It utilizes two-dimensional grayscale images to evaluate both global and regional function of the left ventricle and uses peak global longitudinal strain to measure systolic function. The introduction of speckle tracking echocardiography has allowed for a more comprehensive analysis of left ventricular systolic function when compared with left ventricular ejection fraction by assessing myocardial deformation in these 3 directions. In essence, global longitudinal strain, or GLS, is a direct measurement of myocardial changes, rather than the indirect measurement of left ventricular ejection fraction, which is based on volume calculations, and is the most frequent type of strain used to characterize left ventricular systolic function in clinical practice. Despite the obvious advantages, the accuracy of GLS measurements have largely been dependent on operator skill. Even though studies have shown variability reductions and reproducibility improvements even among inexperienced observers. In recent months, however, the literature has reported that artificial intelligence can further improve precision in strain measurements. What are the clinical uses of global longitudinal strain? For the last 2 decades, we have had data showing that GLS is more informative than left ventricular ejection fraction. It is a better predictor of death, and it allows for better classification of left ventricular dysfunction. We know that strain can add clinical value to diagnosis, prognosis, and management in a wide range of cardiovascular indications, from heart failure and coronary artery disease to valve disease and cardio-oncology. Among the clinical applications of global longitudinal strain we have the early detection of left ventricular systolic dysfunction and heart failure, identification of left ventricular hypertrophy and aortic stenosis, detecting coronary artery disease, and of course, identifying outcomes in patients with this famous virus. Now let's talk about the use of artificial intelligence for measuring global longitudinal strain. Artificial intelligence is a hot topic in healthcare, where its utility in everything from drug development to image analysis has been heavily documented. In the last year, the use of artificial intelligence has accelerated across healthcare, creating a newfound trust in and familiarity with the technology. So let's talk about the benefits of using artificial intelligence for global longitudinal strain. Ultrasound devices can be powered with new technology to automate cardiac measurements, such as ejection fraction and strain, in a matter of minutes. Artificial intelligence can speed up the time to results and free up skilled professionals to concentrate on higher value tasks. Also, can ensure zero variability in analysis, regardless of the observer's level of experience. Everything comes with a challenge. So what are the challenges of global longitudinal strain? Despite the growing evidence supporting the value of strain in left ventricular assessment, seamlessly integrating it into routine practice has proved elusive. The challenges, from the additional time it takes to issues around resources and cost, has been apparent in the echo community for almost 2 decades. Now let's talk about the limitations of global longitudinal strain and how the artificial intelligence can help to solve some of these limitations. First, we have the inter-observer bias. Artificial intelligence has shown great promise in helping to solve observer variability, which is still an issue in strain echocardiography. Beyond the known bias between manually adjusted contours, even when operators of the software are blinded to a patient's history, observer bias can be prevalent in medicine when observers fit measurements to fit their clinical observations. Artificial intelligence can automate all the work and remove user bias, leaving no room for error, including the automation of contours. The key is a robust artificial intelligence model that can be well trusted without the need to manually adjust and introduce bias. Another limitation is the inter-operator variability. This is a real issue for facilities which have multiple vendor cards. It is highly recommended to either utilize a strain analysis solution that can be used across multiple ultrasound vendors, or to ensure patients receive strain analysis from the same vendor each time. As we begin to use smaller form factor equipment such as POCUS and mobile equipment to work through patient backlogs, finding a solution that can work for all images should be a major consideration when procuring analysis software, for strain especially. Another limitation is time constraints. Artificial intelligence services can play a significant role so strain can be used more routinely in clinical practice. Whilst existing software solutions add artificial intelligence to automate certain aspects, they still require manual intervention, which can add several minutes of processing time to each exam. Another limitation is resource and cost constraints. This can be a difficult hurdle to overcome. Some facilities may not always have the newest equipment, and many sites are capital constrained due to the pandemic reducing budgets. Now let's talk about some of the uses of global longitudinal strain. The first one is cardiotoxicity. With more people surviving cancer than ever before, cases of cardiotoxicity are on the rise, making cardiac monitoring an essential part of cancer care. Left ventricular dysfunction is a known side effect of some chemotherapy treatments, including anthracyclines, a cornerstone of treatment in lymphoma, leukemia, sarcomas, and some types of breast cancer. The effects of cardiotoxic cancer drugs, which also include monoclonal antibodies such as Herceptin, can develop years after treatment. But regular monitoring can help teens to identify left ventricular dysfunction early, allowing them to intervene before the problem contributes to heart failure. Indeed, guidelines from the British Society of Echocardiography recommend that global longitudinal strain is measured in all cardio-oncology patients, as ejection fraction alone will not detect subtle early myocardial injury. Now let's talk about the uses of global longitudinal strain in heart failure. The global public health burden of heart failure is not only significant but is continuously increasing. In the United States, around 5.7 million people have heart failure, a figure that is expected to rise to 8 million by 2030. Patients experience debilitating symptoms and frequent hospitalizations, meaning heart failure can significantly impair quality of life, and it also presents healthcare systems with substantial costs. Traditionally, teams have used ejection fraction to measure left ventricular function, but changes detected by left ventricular ejection fraction lag far behind subclinical disease progression. This is evidenced by the growing number of people. Now, more than half of all heart failure patients are diagnosed with heart failure with preserved ejection fraction. There is now a growing and irrefutable body of evidence to support global longitudinal strain as a more useful metric. Comprehensive evaluation of global longitudinal strain in heart failure patients provides additive prognostic information and can play a significant role in improving risk stratification in chronic systolic heart failure. Now let's talk about the uses of global longitudinal strain during the pandemic. During the early days of the pandemic, healthcare teams became painfully aware of cardiac injury in hospitalized patients. Almost a quarter were diagnosed with cardiovascular complications, which contributed to around 40% of all deaths related with this virus. Infection has also been linked to long-term cardiac damage. A study of 148 patients from 6 acute hospitals in London found half of those admitted with this virus had raised troponin levels a month after discharge. MRI showed myocarditis, infarction, ischemia, or a combination of the three. Another paper published in JAMA Cardiology found cardiac abnormalities in 78% of the MRIs taken from 100 people who had recovered from the disease in the previous 2 to 3 months. Ongoing myocardial inflammation was identified in 60% of the scans, and 76% of participants had elevated troponin levels. We learned that people with cardiac risk factors and established cardiovascular disease are at an increased risk of developing this virus, of having more severe disease, and experiencing worse clinical outcomes. We also know that this virus can cause acute cardiac complications. Recognizing patients with previous cardiac disease or new cardiac complications during the disease is of the utmost significance due to the adverse impact on outcomes. Echocardiography has played a central role in the response to this virus, both in its acute and chronic manifestations, and the evidence suggests that strain has much clinical value to offer. A systematic review and meta-analysis published in January 2021 concluded that lower left ventricular global longitudinal strain and right ventricular free wall longitudinal strain were independently associated with poor outcome in patients with this virus. This virus-induced inflammation can result in left ventricular and right ventricular failure, and studies have shown that patients, especially those with obesity, diabetes, or hypertension, have reduced basal left ventricular strain, said the study. A subgroup analysis indicated that for every 1% decrease in left ventricular global longitudinal strain, mortality increased by 1.3 times. This virus placed echocardiography on the front line of pandemic care and compounded existing challenges, including workforce shortages. Now let's talk about the advances of strain. The challenges of dealing with acute and chronic patients of this virus have brought the need for faster, safer, and more accurate measurements of left ventricular dysfunction into sharp focus. And with the mounting evidence for the use of strain as an outcome predictor in cardiotoxicity, heart failure, and patients with this virus, places strain echocardiography at the center of the management pathway. The automation of global longitudinal strain measurements is important in advancing this model and helps the community mount its response, while helping to overcome pre-existing challenges such as staff shortages and skill gaps. And this is the first of two videos I'm going to do about GLS. This one is more about the theory, and the next one is going to be more practical. I'm going to be demonstrating in an echo machine how to perform global longitudinal strain and how to do all the measurements. And this is it. Don't forget to like this video, subscribe to my channel, and I will be uploading the next practical video very soon. So take care. Bye.